Far more contagious than anything, including, for example, COVID-19.
The outbreak and the outlook. Cases of a potentially deadly disease identified here in Toronto. The risk and the recommendations. You'll want to hear from public health experts. Good evening. 3 instances of the rare meningococcal infection have been confirmed so far. One of those cases fatal.
The big question now, what is the possible link? Tonight, the important information about that illness and immunizations. CTV's Janice Golding is live with our top story. Janice.
Hi, Nathan. Experts tell me that meningococcal disease doesn't spread easily through the air like COVID. However, it's caused usually through close contact, like kissing or sharing common items like cups, utensils, and musical instruments. So Toronto Public Health is trying to figure out exactly how and where an outbreak began in our city. A rare and deadly strain of meningococcal disease has broken out in Toronto.
We usually see 5 or 6 cases of meningitis in total in a year.
But between July 15th and July 17th, 3 people between 20 and 30 years of age got sick, and 1 has died. None were vaccinated.
The bacteria can either cause meningitis, which is an infection of the brain and spinal cord, or it can cause sepsis, which is an infection of the blood system.
Children are routinely vaccinated against meningococcal disease when they're 1 and again when they're in grade 7. So chances are you haven't given the vaccine much thought. Have you been vaccinated against meningococcal disease, meningitis?
No, but I feel like I should be.
I have no idea. Meningitis?
Yeah. Meningococcal disease?
I don't even know what that is.
And that's why Toronto Public Health is asking people between 20 and 36 to check their records to make sure they're up to date.
The late 80s, there were several schools in Ontario, mainly high schools or junior high, where they had small numbers of cases. And that led to adding the vaccine to the school-age population.
Well, it's been a very long time since Toronto saw an outbreak. Those who recently got sick emigrated to Canada from countries that don't vaccinate against the disease. Currently, TPH has not established a link between the cases.
It's also unusual that a cluster of 3 cases occurring over a few days, that they haven't been able to find any link between the patients.
Symptoms can include sudden fever, stiff neck, headache, nausea, vomiting, sensitivity to light, and confusion. Toronto Public Health says the last outbreak it's aware of occurred in 2001. 6 people got sick at that time. 2 people died. Reporting live from Janice Golding, now back to Michelle.